In this video, I go over guidelines and suggestions for shoulder-friendly exercises, which will apply to most types of shoulder issues or conditions or pain in a general fitness, medical fitness, or post-rehab atmosphere, to include shoulder conditions like arthritis, partial labral or rotator cuff tears, impingement syndrome, and anterior shoulder instability. But please keep in mind this is not an exercise prescription, it is just general guidelines and suggestions. So in order to understand shoulder-friendly exercises, the person first needs to understand that there is a concept known as a shoulder safe zone, which I'll briefly explain in a second. And then once you understand the safe zone, you also need to understand what exercises might not be safe, or in other words, might bring out some pain or discomfort based on the safe zone concept. So the safe zone concept is really just a general guideline. There's always going to be outlier situations, but it's pretty simple to understand. In the sagittal plane, as you see here, which corresponds with shoulder flexion, the safe zone in most situations is when the shoulder is within the 0 to 90 degree range, 0 degrees corresponding with being alongside of the body, and 90 degrees corresponding with the upper arm being parallel to the ground. And in the frontal plane, which corresponds with shoulder abduction, where you're moving the upper arm away from the body out to the side, generally speaking, the safe zone is 0 to 60 degrees. And then lastly, there's something known as the high five position, where the upper arm is at 90 degrees or above, and the shoulders are externally rotated, which means that the hands would be slightly behind the head. I'll explain later in this video what this means from an exercise standpoint, but the main thing to know right now is that this position can place a lot of stress on the shoulder capsule and over time can increase the risk of injury when the person is regularly performing exercises with the shoulders in this position under loads. So for anyone who's viewing this video who has ever had a serious shoulder injury, they know through experience and intuitively that when the shoulder is injured, the safest and most comfortable place for it is right alongside the body. And the more the arm is flared out from the body, or the more you reach overhead, the greater of an increase there is for pain or discomfort. And that really sums up what the safe zone means. It basically just means that when someone has a shoulder issue, you want to start off by choosing exercises that minimize how much the upper arm is flared away from the body, and minimize or even initially negate doing anything overhead where the arm has to reach overhead or press overhead. And by doing that, you strengthen yourself within the safe zone, and then you can progress out of the safe zone as the person gets stronger, improves their flexibility as well, and time heals the wound. So now, based on that information, some common exercises which you may need to avoid initially because it takes the person's shoulder and places it out of the safe zone would be lat pull downs, especially pulling behind the head because the person has to reach above the head to grab the bar, and then pulling behind the head creates that high five situation which you want to avoid. Another example of an exercise you may need to avoid initially would be any pressing above the head movements, which could include a seated or standing barbell or dumbbell press, but especially any movement or exercise where you're pressing above your head and your shoulder is in the high five position, such as a behind the head military press. Depending on the shoulder condition, the person may need to avoid flaring their arms out too wide in a rowing exercise, because by doing so, you're increasing the amount of stress on the shoulder capsule and you're doing it under a load. And then in pressing movements, such as a chest press, you're also going to want to avoid flaring your arms out too wide. And that actually should be the case even if the shoulder isn't injured in any way. And then another thing to consider in a pressing movement, such as a dumbbell chest press, would be going too deep in the lowering part of the movement. It's okay to go to a depth where you feel a little bit of a stretch in your pecs, but if you feel a significant stretch and it's under moderate to heavy loads, you're placing unneeded stress on your shoulder capsule, which increases the risk of injury over time. So when performing chest presses, whether on a dumbbell or bench press, I would suggest getting a mind-body connection with your pecs and how much stretch you're putting them on, And as soon as you start to feel a light stretch, it's time to terminate the descent and press the weight back up. And all that is a nice introduction into what would be considered safe for the shoulder with most conditions and situations in a general fitness or post-rehab atmosphere. So we can start with various types of rows. With very few exceptions, rowing exercises are very shoulder-friendly exercises, and especially when the upper arm is alongside the body during the course of the exercise, such as with seated rows. Standing cable rows, whether the person is pulling with both arms at the same time or just one arm at a time. Another example would be a bent over dumbbell row, where you're keeping the upper arm alongside of the body during the entire movement. And another example would be a barbell row, but please keep in mind that the point of all this is that assuming proper form, which includes good posture, pretty much any type of rowing exercise, no matter what position the body is in, is safe on the shoulder as long as the arm is alongside the body, or at the very least it is not flared out too much. And then what you can do over the course of time, as the person gets stronger and time is healing the wound, is you can begin to incorporate rowing exercises with a little bit wider grip where the upper arm is starting to flare away from the body in small increments. Another type of shoulder-friendly exercise for most situations are reverse flies, whether you're performing them with a cable in a seated or a standing position and pulling from various angles. Although it would be up to the person, the condition, and the situation as to what angle they might be able to pull from, there may be situations where it might bring out some discomfort if they're pulling from high to low or from low to high. But in my experience, I've found that that's rarely the case. And because of that, most of the time you want to vary the angles that you're pulling from. And then needless to say, this would also apply to a dumbbell reverse fly. Depending on the situation, the person might need to decrease how wide they go with their movement. So they may not initially be able to flare their arms and the dumbbells out completely to the side. But with everything, you always want to start with very conservative loads and find your pain-free range of motion. And then once you've found it, then you can begin to slowly increase the loads and stay within your pain-free range of motion while you strengthen yourself in 2 or 3 week phases, during which time is continuing to heal the wound, and then you can begin to increase the range of motion from there. Another example of a shoulder-friendly exercise would be a face pull, which you can perform from various angles, because really in this exercise, the upper arm moves in the same plane of motion as it does in a reverse fly. The main difference is that the elbows are bent, which actually allows you to lift more weight. Dumbbell lateral raises are a shoulder-friendly exercise in most situations, as long as the person is starting with a very conservative load. Make sure that they have perfect form, which is going to include perfect posture and staying within their pain-free range of motion. Dumbbell scaptions, which is a slight variation of a dumbbell lateral raise, where your palms are facing forward and where you don't completely bring your arms straight out to the side, but allow them to come forward about 10 to 20 degrees, is going to be safe in most situations. And then exercises that strengthen the rotator cuff, such as a cable lateral raise, like you see here, which includes some external rotation, or an exercise called a 90-90, where the upper arm is flared out 90 degrees and the elbow is at about 90 degrees in start position. But these are all examples of shoulder-friendly exercises in most situations, pretty much all of which should be incorporated in someone's program design. But the main thing is, just keep in mind, at first you want to avoid any reaching overhead to pull, such as a lat pull or a pull-up, or pressing overhead, such as a dumbbell or barbell press, and especially where the shoulder is in that high five position. And you probably want to avoid or limit flaring the upper arm away from the body, because by avoiding those things, you're really keeping your shoulder within its safe zone. And then it's just a matter of finding the appropriate loads, strengthening your shoulder within its safe zone over the course of time, increasing loads and or range of motion in 2 or 3 week phases as you're allowing time to heal the wound. Hopefully you're releasing trigger points through some trigger point release, like with foam rolling or lacrosse balls. And if you have any flexibility issues, which are movement restrictions, you also want to address that as well. And that is a simple tutorial on shoulder safe zone exercises.